The community health center movement started decades ago in the 60s and 70s when individuals in communities that were completely lacking access to health care rose up and wanted to create health care access in their communities. And community health centers are what were developed to address the need.
The dawn of the community health centers movement, which was in the 1960s and into the 1970s, was a combination of both charity, but also change. Charity care because people actually needed those medical services who couldn't get it. But also there was a social justice orientation to the embryonic development of the community health centers.
And when I was in residency in pediatrics and at Children's in Oakland, our medical director, to his credit, said, look, third-year residents, why don't you guys get out in the community and do something that outside of the hospital walls? And we give them pretty good care. I think in today's standards, it would be oh, geez, what were you guys doing back then? But what we were doing is providing something that simply wasn't available, which was somebody to listen, somebody to actually be in their community, culturally available to them, and linguistically available. And in a way that kind of feels like it's the heart of what CPCA is all about.
Community health center boards, actually under federal law, 51% of the board members have to be consumers of the community health center's services. So we have consumer boards. That means that we are governed by the community, and the community has a very strong say and has the key say in where we're going as a health center. So in that way, the community health center movement has really been grounded in the grassroots, grounded in leaders from the local community.
And what has happened is between the 1960s and 70s and now, the era of Affordable Care Act and reform, is that the community health centers have become a much more strategic, impactful, effective, efficient set of business providers, again, staying with the mission, but getting more effective and efficient in how they provide those services. And so what has happened over the years is we've seen this maturation of a group of do-gooders for the community into sharp, business-minded deliverers of services, effective, efficient, and able to compete with many other sharp-edged private sector health industry providers across the state of California.
Prior to CPCA being formalized, a lot of the behind-the-scenes action really happened at the local level. That was where we organized, that's where all the decision-making and policy happened.
We had more associations at one point than we knew what to do with, even though every single association was doing good work for a small subset of people.
Initially, I remember, is this even possible, to bring all these health centers together statewide? There are urban clinics, and there are rural clinics, and there are clinics that serves African American communities and the Asian communities and all that.
We were stuck on the issues of rural versus urban, black versus white, and so on. And I think that we missed the boat, we missed the big picture, focusing in on that as opposed to focusing in on the voice of unity.
There were so many local issues for every subset that eventually made up CPCA, and none of the subsets were big enough to be able to get the attention for anyone other than your most local legislators.
And there was nowhere where we could come together and duke out those differences, if you will, or work those out.
And I can remember, 12, 15 years ago, real discussions between some of the original FQHCs, should we even be part of CPCA? Because CPCA is very different than other state primary care associations. They encompass free clinics, community clinics, federally qualified health centers, and lookalikes. So that gives us more opportunity to grow our programs because we have that much bigger of a group of people that we can work with.
And so once we created that table where people could come and talk about what they were experiencing in their local settings and figure out where the win-win was for all the community health centers, then we really picked up some steam and some wind. And then we started to see things happening.
I think one of the things that's really impressive to me when you say that it's been 20 years, in a way it seems like it's been forever, and in a way it seems like it's brand new.
I think what's less well understood, but no less valuable, is the advocacy part. The advocacy part is the voice part. It's the power part. It's the part that says that for those individuals that are either undocumented or oppressed or marginalized or ignored by the larger society, that they actually have a voice at the table in the power discussions that happen among policymakers. And CPCA is that voice. They are not going to let policymakers, elected officials, or foundation presidents, for that matter, forget what the real meaningful needs are of these patients who need this kind of care.
The advocacy agenda that we have had, I think, has been very important for propelling community health centers to really the center of healthcare delivery here in the state of California.
Really, CPCA came together so that we would have one voice, that we would speak to us, with a single voice, especially on policy issues, and to the state legislature, so we would have the biggest chance of success.
One of my favorite stories is when we bodaciously went after funds at the state level with Assemblyman Gil Cedillo to fund capital projects for the community health centers.
Because of the budget surplus, we thought it was an opportunity to inject into the debate the need to invest in community health centers, an infusion of capital dollars.
And everybody told us that that was impossible, that there was no way we could pull that off. But we had a champion in Gil Cedillo, and we had a unified voice, and we were able to demonstrate not only that we were providing quality of care to a disenfranchised population in many different neighborhoods, but we were also able to demonstrate that our health centers were about economic development, they were about job training, they were about career and leadership development. And when we put all of those things together and found out that we had champions all throughout the state of California, many assembly people told us in the process that they had gotten their health care at community health centers. And once we knew that, and we had that story, boy, we ran with it.
And it was really a wonderful victory because it just showed the power of what you can do. I mean, never say never. Who would have thought we could pull $50 million out of the state budget for community health centers? But then it became a leveraging opportunity. Once the fund was established and we were able to demonstrate and document very significant outcomes in terms of clinic expansion, there were other opportunities later where dollars were further invested in the fund from other sources, and so we were able to have a multiplier effect. It wasn't just 50 million. That was kind of got our foot in the door for other expansion efforts.
We are now no longer marginal providers. We are playing in the big time. And I think this is where we can use our state association to further create the infrastructure that we're all going to need and don't need to replicate on an individual clinic basis, but also to be that voice to make sure that our policymakers know how each of our communities are being affected and where they can make policy and enact law that's going to advance us as a movement and therefore the communities we serve.
So we're playing a very significant role in providing healthcare access, and our policymakers have recognized that. And that is really where the power of the unity of our movement comes in, because we've been able to take this diverse set of clinics with geographic diversity, with business model diversity, with size diversity, and yet in the Capitol, we're able to paint a picture of a unified group of health centers all committed to the cause of advancing healthcare access.
And so the advocacy voice of CPCA has grown to become quite powerful over the years. It's been a wonderful thing to see. And now I think CPCA can go toe-to-toe with their hospital colleagues, with the health plans, with the insurance companies, and other groups that have historically had a lot of the influence and say in how policy decisions are made.
The community health centers have been validated by this movement, or at least the discussion, the early discussions that are happening about creating the care teams, creating the medical homes. And that's been very validating for us because it is proof that what we knew all along, which was that our 10 minutes or our 15 minutes with the patient is not where change happens. It's about what you wrap around it. And we've been validated on that point. And we know now that if we're going to bend the cost curve, then we have to wrap those services around our communities to make that difference. And it's really interesting to watch the rest of the healthcare industry catch up with that notion and begin to embrace it.
I mean, think about it. A community health center, we provide primary care, dental care, eye care, mental health, nutrition and counseling services. All these are available under one roof in one place. That's a pretty unique model. You're not going to be able to find all that in an individual physician's office. But we, as providers that are, again, the only provider in a community, have really had to add on and expand our services in order to meet the need. I mean, even specialty care. There are many community health centers now that actually bring the specialists in-house. It might only be 2 days a week, but they have the specialists available because that is the way to make it most accessible for the patient. For the last 20 years that I've been involved in healthcare, we have millions of individuals in California who don't have insurance, and the community health centers have been an open door provider to provide care for so many people who otherwise would go completely lacking or would only have access to the emergency room.
Once I was in a community where, I had to seek care. I was born and raised in Japan, and English wasn't exactly my first language or primary language. And so I remember using county, facility, and I didn't exactly understand at that point what was done to me. And so I always kind of remember that experience, how difficult and that whole healthcare seeking attempt can be very difficult. So that's just one little thing that I remember personally, that I wanted to have other people to have easier access to healthcare.
Well, it's truly a hallmark of community clinics and health centers, the whole notion of cultural linguistic competence, that we speak the language of the individuals that we serve, and many folks who work at the health centers actually come from the local community. In some communities, a community health center is the largest employer for individuals, and the individuals that we employ are those from the surrounding community.
Well, I think that in the past 25 years where we developed health center programs that most patients benefit from would be the availability of bilingual services when in fact they can't really go anywhere else that can receive bilingual services and affordable care and a bunch of other services that private sector typically doesn't provide. And so that would mean outreach and health education, enrollment services, and all of that.
It's part of the way of doing business for a community health center that you have employees that understand, can meet the needs of the patient population and come from that community.
Que uno tiene algo verde y eso es donde puede dejar esto sin tener que esperar.
I told them that whatever you get sick, you can do your culture, but mainly that you see doctor first. Then the doctor understand, oh, you can do this too, but go ahead, do your culture too. And culture and our Western medication and both help each other, and then you can feel better. The doctor, they understand our culture. When you come and they ask them, have you tried your culture? Have you tried your culture before you see a provider? And they listen to you, what you tell them. People that they don't want to take medication if they feel good. They want to take medication when they feel sick. The screening for the future, that if for example, screening for cancer, and all kinds of problems like diabetes, hyperpressure. And I believe now we are healthy in the United States and everybody happy with that.
The state association has a way of embracing the urban centers, the rural centers, the migrant farm worker areas, the homeless issues, the HIV/AIDS program populations, and all the multiple groups that we serve as health centers in the state. I feel that an exceptionally good job has been done to try to make sure that all of those constituency groups have essentially the right amount of airplay, that attention is paid to them, that essentially there's a focus on each one of them. And so I think that that's been great here in California.
One of my favorite memories to recall about CPCA is around Proposition 187, and that had an impact on the prenatal care that we were providing our communities and the ability to get paid for it. So the State Association, in conjunction with MALDEF and public advocates, came together to create a case. And ultimately, we were able to prove that, in fact, eliminating prenatal care for undocumented women actually cost the system, or the joint effort with 3 different cases culminating in a victory and overturning Proposition 187 was a great victory. And I'm positive that we couldn't have done that without having the infrastructure that CPCA brought to that fight. And it was a dogfight.
Yeah, I think the community health centers in California, first of all, they played a preparatory role for getting California ready for the Affordable Care Act. California was already there. We were ready for this change. We were waiting for this change. And part of our readiness was the leadership and presence of community health centers in Sacramento and in their communities and in Washington, saying we need this, we want this, we must have this. So California was more ready than other states, number one. Number two, what California community health clinic leaders do is remind us of what this is really about. This is not just about transactions. This is about fundamental care, quality of care for underserved populations and communities. That's the compass that we're all driven by, and community health center directors and leaders will never let us forget that.
The other important opportunity that healthcare reform brings is the opportunity to actually look at who's left out. And the Affordable Care Act, unfortunately, does not provide coverage for undocumented immigrants. And community health centers in California serve everybody, regardless of immigration status, and the undocumented are a segment of the population that are served at community health centers.
Now, at the end of 2013, prior to the Affordable Care Act, we still had 83% uninsured, which is still a very high number. And as of March 31st, we had still 65% uninsured. A lot of our patients are undocumented, so they're not going to qualify and they can't buy insurance. So it still helps us see those patients that so desperately need us, that provide services to our community.
Now, if we're successful with the ACA, which I have every hope that we will be, people will have an insurance card and they will not be bound to anybody in particular, you know, and can we catch up? I would argue that we're already ahead of most of the private practices.
The LARA bill is looking at how we can provide healthcare coverage for everybody, including undocumented immigrants. And we are very supportive of exploring this mechanism to see if there isn't a way that we can provide coverage for everybody. So we are in support of this effort, and we hope that it will ultimately result in providing healthcare coverage for everybody in California. That's regardless of immigration status.
is one of the other things is that we want to make sure that at least to some degree that the same amount of revenue flowing to us for the care is about the same, because we are serving the lowest of the low-income patients when you kind of look at it. So we're looking at the most vulnerable with all kinds of needs. As Deb spoke about, for example, we have to pay for transportation costs, whether it's taxi vouchers, et cetera. And the payment system as it now is, though not perfect, helps us cover some of those costs. And so losing some of that puts up more barriers for our patients to actually receive care.
It's all about improving access and quality for our patients. And so we're kind of having to learn a new language, kind of an industrial language of how to actually be more efficient and sort of value-based in what we do. So it's kind of a new language. You know, before it was kind of a heart language. Now it still has the heart in it. And I think that's one of our challenges, to retain the heart, but also to actually get more value out of what we're doing. And I think CPCA now is really about that, being able to recognize that, hey, we're the providers of choice. What's that mean? It means that we're actually available, culturally available, linguistically available in the community, but also providing real value.
And what has been good about CPCA is that I don't believe that we left behind the original purpose. The subsets continue to exist within the weaving of CPCA, and each strand is really important, but we realize that bringing those strands together created a weaving that was much stronger than any one of the strands.
I don't know if I ever could have imagined 17 years ago when I came to this association that we would end up being really the powerhouse that we are in Sacramento, representing the interests of community health centers. And it's really been through the tremendous staff that I have been fortunate to work with over so many years. And the staff here really stands hand in hand with our membership to advance the community health center movement.
I think the future for CPCA is very bright because we now know how strong we can be when we work together.
You know, I think this organization needs to continue to not have any fear and move forward and really take some bold steps to try to make sure that community health centers really achieve their rightful place in healthcare delivery transformation. And I think that rightful place is at the center.